My name is Brajesh Lal, and I'm a trained surgeon, a vascular surgeon, and an endovascular specialist. I'm part of the Department of Surgery at the University of Maryland, and I've recently joined here just about 6 months ago. However, I've been in the practice of vascular disease management for almost a decade. I treat patients with vascular disease, with blockages in arteries as varied as the carotid artery, arteries to the arms, the big artery in the chest or in the abdomen, the aorta, the iliac arteries that supply blood to the legs, and then arteries to the legs, and also blockages to the renal arteries that supply blood to the kidneys and to the mesenteric arteries that supply blood to the small bowel. As all of us are aware, atherosclerosis, which is the buildup of plaque within blood vessels, is a rapidly increasing problem within the United States. There are an increasing number of deaths and morbidity associated with it, and I consider it to be my job to make patients and physicians that are not specialists in vascular disease more and more aware about the problems associated with atherosclerosis. I obviously enjoy my work, and I enjoy the fact that I can help patients, but at the same time I also enjoy increasing the amount of information available to treat vascular disease and to forge new methods of managing and diagnosing vascular disease. So I have an interest in how our body compensates by developing collaterals or little alternate branches around blockages in our arterial system. I also have a strong interest in trying to identify what the structure of the plaques and the tissue that comprises these plaques and how that interacts and changes the way that these plaques behave. In other words, we do know that a lot of people can be walking around fairly comfortably without any problems, even though they have several plaques in their arterial system. On the other hand, there are other patients that could have the same amount of plaques and yet have strokes or have poor kidney function or have difficulty walking, something we call claudication, or even gangrene. And I do believe that there is a lot to do with how that plaque is structured and what it is composed of, and how different molecules and chemicals within the blood and the body affect those plaques that ultimately affect how that plaque behaves and affects you as a patient.